Picture this. It's 2 in the morning, your phone buzzes, and you've got a new message on a dating app. You open it up, and it's just a single, completely innocent-looking emoji, an ice cream cone. So what does that actually mean? Well, to anyone just casually scrolling, it looks like a random, maybe slightly weird, late-night text. But if you know the culture of certain digital spaces, you know that tiny little graphic is actually a highly specific, coded advertisement for a massive hidden public health crisis.
Welcome to today's Explainer. We are diving into a really urgent and frankly deeply concerning issue right now, the alarming convergence of geolocation dating apps and the methamphetamine epidemic. We're going to look at exactly how platforms that were built for community and connection have essentially mutated into what experts are calling digital sanctuaries for illicit drug markets, and how this is driving a really dangerous normalization of addiction. All right, here is our roadmap for today. We'll be hitting 5 main points. First, decoding the digital sanctuary. Second, the mechanics of normalization. Third, a staggering health crisis. Fourth, the societal ripple effect. And finally, number 5, disrupting markets with stings. Let's get right into it.
Part 1, decoding the digital sanctuary. We really need to start by translating the hidden language of partying to understand how this all works.
Okay, so when you're on these apps and you see the word partying spelled with a random capital Y or maybe another word with a weird capital T, yeah, that is definitely not a typo. It's an umbrella term for P&P, which stands for party and play, basically engaging in sexual activity while under the influence of drugs. That capitalized Y or T is a brilliant, highly effective linguistic trick. It acts as a direct code word for Tina, which is a common street name for crystal meth. By just capitalizing one single letter in a totally normal word, dealers and buyers can completely bypass the automated moderation algorithms that these platforms use to flag explicit drug terms.
And take a look at how wild this gets with emojis. You see an ice cream cone, an ice cube, a diamond, or a cloud. These aren't about the weather or dessert. They're explicitly signaling crystal meth or blowing clouds. Words like party or hosting tell people that drugs are available right then and there. A syringe emoji signals intravenous use or slamming. It's this constantly evolving lexicon that basically hides a massive, roaring drug marketplace right in plain sight. It makes buying highly addictive narcotics look as casual and mundane as sending a smiley face to a friend.
Moving on to part 2, the mechanics of normalization. Let's look at how we go from a standard dating app to essentially an on-demand delivery service.
The shift in how these drugs are distributed is just stark. Think about traditional drug markets. They require physical travel, you need trusted networks, and you take on a ton of high-visibility street risk. It's inherently dangerous, and more importantly, it feels dangerous. But geolocation apps, they sort users by exact physical proximity, sometimes literally down to the foot. It creates this Amazon Prime effect for narcotics. You get instant, hyper-localized, completely anonymous delivery. And because you're buying from a profile that looks exactly like a peer, it completely strips away the perceived danger and the visual stigma of buying drugs. It just feels safe, casual, and totally normal. But the reality is, it is anything but safe. What we're seeing is a really tragic, mechanized cycle. It almost always starts with that initial exposure to those normalized party codes on the app. That opens the door to casual use, where the massive dopamine surge of meth gets powerfully linked with sexual reinforcement. Over time, that combination triggers a severe neurochemical shift in the brain. It actually downregulates and depletes its own dopamine receptors. And that leads to step 4, total dependency. The real tragedy of this loop is that as the addiction isolates the user from their actual, real-world friends and family, the dating app often becomes their sole remaining social connection. So they are literally locked inside of the exact ecosystem that is fueling their addiction.
Which brings us to Section 3, a staggering health crisis. We need to talk about the syndemic of meth and HIV.
When you look at the data, the numbers are just jarring. In the general U.S. adult population, methamphetamine prevalence is incredibly low, hanging out at less than 1%. But if you look at a general sample of urban men who have sex with men, or MSM, that jumps significantly to between 5 and 10%. And here's the really alarming part. Among active geosocial app users in those urban centers, it skyrockets to an estimated 12 to 22%. You can clearly see right there on the chart how heavily concentrated and normalized meth use has become specifically within this active digital demographic. And the public health fallout from this is extreme. 7.11 times, according to national cohort data. That is the massively elevated odds of HIV seroconversion, which means a user becoming HIV positive for persistent meth users compared to non-users. The drug causes such profound disinhibition that it drastically reduces condom use and adherence to PrEP, the daily medication that prevents HIV. So we aren't just looking at an addiction crisis. This is a true dual-threat syndemic of both addiction and rapid infectious disease transmission. Let's move to Section 4, the societal ripple effect, because we really need to understand what happens when this digital sanctuary spills over into the real world. If we track this chronologically, it tells a really disturbing story of expansion. Back in the 1990s, private stimulant use was mostly rising in very specific subcultures. But then, hit 2009, the explosion of smartphone geolocation apps basically poured gasoline on the fire, radically accelerating access. Fast forward to 2021, and massive law enforcement stings like Florida's swipe left for meth operation revealed just how massive and hyper-localized this app-based dealing had become. And now, as of 2024, research shows that over 5 million U.S. homes are documented as contaminated with meth residue. What started in a niche digital subculture has literally evolved into an environmental and systemic public health disaster affecting millions of people who don't even use the drug. And the financial toll of that environmental spillover? It's almost incomprehensible. $250 billion. That's billion with a B. That is the estimated national backlog cost just to remediate those meth-contaminated housing units. See, when meth is smoked, this toxic residue lingers on walls and surfaces for years. It creates a third-hand exposure risk that poisons new, completely unsuspecting residents, putting innocent families and young children at severe medical risk. So the takeaway here is that this app-facilitated drug trade creates massive systemic harm that burdens all of us, the entire taxpayer system. The addiction fuels spikes in property crime, robberies, and localized violence as users desperately try to fund their habits. It places an unimaginable strain on child protective services and the foster care system. It's also created a rampant secondary market for drugs like GHB, which has led to a surge in dangerous overdoses and drug-facilitated assaults. And crucially, through bisexual men and overlapping social circles, this crisis acts as a direct bridge, spreading meth exposure and STI transmission right out into heterosexual networks as well. All right, our final section, Part 5, Disrupting Markets with Stings. How do we actually stop this runaway normalization? How does law enforcement operate in this encrypted digital grid? To understand the solution, we have to understand the modern dealer. There's this really revealing quote from the Polk County Sheriff's Office right after their swipe left from meth investigation. They said, for many suspects, the primary purposes for being on the dating app were to sell drugs, not to find a date. It perfectly highlights the professionalization of the casual dealer on these platforms. We aren't just talking about users sharing a bit of product with friends. These are organized individuals explicitly exploiting the digital sanctuary of a dating app for commercial drug distribution. And honestly, the results of these undercover stings speak for themselves. In just that one 6-month undercover operation in Florida, 68 individuals were charged. Law enforcement seized over 280 grams of meth, which is roughly 1,400 doses, along with fentanyl, cocaine, and 14 firearms, including assault-style rifles. But the most telling stat? Those targeted suspects had a combined 908 previous charges. These concrete metrics prove that ethical sting operations are incredibly effective at removing high-level, well-armed, repeat offenders directly out of that digital ecosystem. If you compare the tools we have to fight this side by side, it becomes really clear why targeted sting operations are functionally necessary. Platform moderation, it has low effectiveness because, as we saw earlier, it's just too easily bypassed by constantly evolving emojis. Community outreach is absolutely vital for long-term public health education. But let's be real, a public health pamphlet cannot stop an active, armed cartel dealer. Sting operations, on the other hand, have high effectiveness. By engaging undercover, they pierce the encrypted veil of the apps, directly disrupt the supply chain, and create immediate, palpable deterrence. The psychology of why these stings work is actually really fascinating. By proving that an unsolicited drag message could actually be going to a detective rather than a customer, stings successfully reintroduce risk back into the equation. They shatter that illusion of the digital sanctuary. Because if dealers feel their private inbox isn't safe anymore, they stop openly advertising. And that forces these illicit markets out of casual, everyday visibility, effectively ending the dangerous normalization that lures in so many new users in the first place. Before we wrap up today's explainer, it is so absolutely vital to remember the human cost behind all these numbers. If you, or maybe someone you know, is trapped in this cycle of meth addiction or PNP,
Please know that you are not alone and comprehensive, culturally competent support is standing by right now. You can contact the Samson National Helpline at 1-800-662-4357. Help is totally free, it is strictly confidential, and it is available 24/7.
I'm going to leave you with this final provocative thought to chew on. These dating apps provide essential, safe connectivity for so many people. For a lot of marginalized groups, they are a true sanctuary. But as we've explored today, that dual-use technology is being actively weaponized. So how do we balance the absolute necessity of digital privacy with the urgent, undeniable duty to disrupt a public health catastrophe? It's a massive, complex challenge, but it's one we absolutely must face to protect our communities. Thank you so much for joining me on this explainer. Keep learning, stay curious, and I'll catch you next time.